We were talking about some of the issues, and I think with regards to the psychosocial support needs of adolescents, the focus on sexual and reproductive health issue really is crucial. Access to antiretroviral therapy has meant that children are surviving into adolescence and beyond, and this means that we need to be thinking about adolescent service provision. Development for HIV-positive adolescents is greatly complicated by the infection. For example, sexual relationships bring with them the risk of infection with a different strain of the virus and the possibility of partner infection. But I think that young people represent a window of opportunity to stem the tide of HIV infection, and we need to think about sexual and reproductive health programs that can effectively meet the needs of this population. And there is, of course, here a link with disclosure. Adolescents need to be aware of their status in order to make healthy behavioral choices. There's an enormous advantage to disclosing to younger children as well. For example, there are benefits related to treatment adherence and also to mental health. But concern remains, for instance, around the question of when and how to disclose. And the CRC initiative creates a space for discussion and exploration so that we can have informed action in terms of addressing the many issues that are represented by disclosure. Speaking about the role for LINC, I've worked closely with both the Children's Rights Centre and REPSI for a number of years. And in terms of LINC, I think that there's an opportunity, an important opportunity, to share information that is of concern to those working in the children's sector, particularly those who are involved with pediatric HIV and AIDS. The CRC report, for example, will include stakeholder interviews, focus group discussions with the caregivers of children who have been disclosed to, and discussions with the children themselves, as well, of course, with a literature review and the input from a forum that was hosted by the CRC in Durban recently. This was extremely well attended by various stakeholders, and I think this is an indication of the importance of the disclosure issue. Once completed, this report will be posted onto the LINC website, and hopefully fellows will be able to respond by providing input and perhaps by acting or assisting in moving forward some of the recommendations that are likely to emerge from this report. With regard to the future, I think that there's a tremendous amount that needs to be done in the field of pediatric HIV. For example, working on the disclosure project revealed that there's a dearth of literature related to pediatric disclosure of HIV status to children, specifically in South Africa and Sub-Saharan Africa more generally. And this also appears to be the case with adolescent sexual and reproductive health, where there seems to be very little that can guide healthcare providers, communities, families, and the adolescents themselves through the experience of development as a young person who is HIV infected. So I think identifying and responding to the gaps can only help us to ensure that we're more effective in providing the support that is sorely needed in this sector.